Okay, we are live.
Yeah. Hi, good morning, everyone. So this is something which we have introduced now about few topics which can be debated. And I hope that it adds value and gives you some clarity about the controversial things which are there related to certain topics. So today's first debate would be whether IVF is the treatment of choice for unexplained infertility of more than 3 years. And I will be speaking for it that IVF should be offered to couples with unexplained infertility of more than 3 years. And Dr. J will be speaking against it. So I would like to start with my points.
Go ahead.
Yeah, thanks. Oh, thank you. Okay, so unexplained infertility, as we all know, is a very challenging and frustrating thing which we come across in our practice. And unexplained infertility is when there is normal factors in the tube, in the semen parameters, and when there is documented ovulation in the women. Here again in the topic, I have put in 3 years as the time frame for the duration of this unexplained infertility because majority of the couples conceive in the first year of trying of marriage, and 50% of who don't conceive, which is about 16 to 20%, will conceive in the second year. And spontaneous pregnancy rates are very less after 3 years of duration of infertility. So as we give importance to the age of the woman, I think duration of infertility also should be given equal importance when we offer treatments. So in this case, I mean, 3 years is something which we should consider. Of course, I have not mentioned the age in the topic, which again is a significant thing, which I think we will discuss in the end. But here, according to the ISHRE and ASRM and all that, the unexplained infertility definition will say only about the ovulation, tubal factors, and semen parameters. The other factors like AMH, AFC, and all are not included in the definition. So there are various modalities of treatment options which the couple can be offered, starting from expected line of management, wherein you don't do anything and still they end up conceiving, or you offer them the ovulation induction, or ovulation induction with IUI or natural cycle IUI. So these are various permutation combinations which can be offered to the couple when they come to you with unexplained infertility. But what I'm trying to emphasize is when there is already a documented ovulation, and already that you know that there is no psychosexual factors, or there is no anatomical problems which are there, then how is, like, the ovulation induction or even the IUI is going to be beneficial? So doing ovulation induction in a woman who is already spontaneously ovulating, I don't think that is something worthwhile, because you're just giving them spectacles when they already have a 6x6 vision. IUI again may not be a relevant treatment option in these cases because there is no anatomical factors, or there is no factor with regard to, say, surgical, wherein they have had cone biopsies, or there is no factor of psychosexual element where they have been having regular sexual intercourse. IUI may not be a great add-on factors. And if we are doing a combination of ovulation induction and IUI, what are we achieving? I mean, we don't even know whether the fertilization is going to happen, and whether there is a documented, or whether there is implantation which is going to happen. So coming to the final treatment which we can offer, which is the IVF and or with ICSI. So in IVF, at least we know that, like, we are putting a embryo into an endometrial cavity where the potential for implantation is quite good. Also, the time duration for the pregnancy with IVF is much lesser when we compare it with the ovulation induction or with the IUI. And the most important benefit of it is it reduces the chance of multiple pregnancy. Unlike in ovulation induction with gonadotropins, which can increase the risk of multiple pregnancies, and we know how challenging multiple pregnancy management during pregnancy will be. So coming to IVF, I mean, now we know that IVF is much more evolved, as in scientifically also. There are short protocols with antagonist, which is quite patient friendly. There are good embryo culture conditions which can be followed along with the great vitrification process. And doing elective single embryo transfers reduces the risk of multiple pregnancy, at the same time giving a very good success rate with blastocyst transfer. So I know, like, with a comparison between IUI and IVF has not been done in majority of the studies. It is done only like in the second year of unexplained infertility, where many a times, even without any treatment, even without IVF or even without IUI, patients have conceived naturally also. And also the one IVF cycle to one IUI cycle has not been compared. It is about one IVF to three IUIs which has been compared. And in that, it is almost like IVF benefits over IUI. So coming to the time consumption, coming to the mental framework of the patients and all that, the acceptance after 3 years of unexplained infertility, which is a frustrating condition, IVF gives a better edge with regard to the time to conception rate, reduction in the multiple pregnancy rate, and also with regard to the financials. So I think now IVF, because of availability of short stimulation protocols, the costing is not that big a challenge as it was before. So we know each IUI sometimes may go up to, with gonadotrophies, may go up to 20-25,000, wherein 3 cycles may come up to 75,000. And if you just put in like another, say 15-20,000 rupees, you can finish one cycle of IVF, even including vitrification, if you have good numbers. So ultimately, I would like to say that, yes, I mean, IVF should be the go-to treatment in cases of patients where they come with unexplained infertility for a duration of more than 3 years, rather than beating around the bush and wasting their time and energy and effort with multiple other treatment options, which may not really be scientific enough to offer to them. And the last thing is unexplained infertility, as we know. I think there will be some element of, say, problems with the oocyte quality, or some element of mild endometriosis, which is commonly come across. In such cases, again, IVF gains an edge over it, because we can always do it more scientifically, telling them that what they're getting into, so where they stand with regard to the oocyte quality, where they stand with the embryo quality, with fertilization rate, with implantation rates and all that. IVF gives a better patient satisfaction, better patient acceptability, when patients now are very well aware of the treatment options because of so much of information which is available on the social media platforms. So this is my thing. I would hand it over to Sir to present his part of the debate.
Right. So hi everyone. But before I start the debate, I want to tell, right? Whenever there is a debate, at that point in time, at the end, right? Somebody has to win and somebody has to lose. Correct. So I cracked this statement, which I think is very nice, right? How can you win when I mean, how can you lose when I don't want to win, right? And that is the conclusion which is going to come out of this debate as well. Okay. The reason why I'm stating this is, though Dr. Shilpa G B has mentioned many things as far as IVF being cost effective, IVF being the treatment of choice, and all these things. See, try and understand one of the most important things which we often don't do in our country, and 80% of the centers still don't do in our country, is a sperm DNA fragmentation. Despite having multiple attempts with ovulation induction, or despite having unexplained infertility for approximately 2 years, 3 years, 4 years, or whatever we may call it, the minute you do a DNA fragmentation, and if the DNA fragmentation report is grossly abnormal, let's say the DNA fragmentation report is 45%, that means the male partner never had normal semen parameters. Okay, despite having a normal semen analysis. So when this guy never had normal semen parameters, you can't really put him into the bracket of unexplained infertility. It is a male factor infertility. So that is a very, very important take home point in my opinion, that you must do a sperm DNA fragmentation for all patients of unexplained infertility. You will have many patients out of this who will turn out to be, high DFI male factor or something like that, which you will be able to treat. And once you are able to treat, the patients would conceive, right? Second, in our country, uh, there is a lot of there are 80% of the patients in our country will end up opting, if they are not conceiving with standard ovulation induction through a gynecologist or a fertility specialist, to go to alternative medical approaches. Somebody will try Ayurvedic therapy, somebody will try homeopathic therapy. That barrier has still not gone in our country. So if ovulation induction for unexplained infertility fails, they will go to a homeopath, they will go to an Ayurvedic consultant instead of doing an IVF. Okay. And what is going to happen is, some of them, like let's say out of 100 people who go to them, 20-25% of the people would conceive any which ways. One of the factors, if we study their literature, one of the reasons why they conceive is due to a very good management of the overall body. That is overall management of homeostasis, that is stress management, oxidative management, so reduction in the oxidative stress in the body, and calming the body from all the other angles. That is something which I think should be also worked upon in unexplained infertility by allopathic practitioners or by fertility consultants, because that also gives you a very good success rate in unexplained infertility. Okay. Madam, you mentioned an important point about ovulation induction. Okay. So I think in ovulation induction, what is very, very important is still, just a minute. Okay. Sorry. Right. So what is going to happen is, in this particular type of a situation, can you hear me? Because a flight announcement is going on.
Yes, yes, we can hear you
Okay,
clearly.
fine, sorry. So in this particular type of situation, we must also keep this in mind, that whenever we are doing ovulation induction, our ovulation induction is optimal. See, a lot of times there is a huge mistake in stimulation protocols. People will give letrozole in the incorrect dose. People will give gonadotropin in the incorrect dose. People will add antagonist. People will add GnRH agonist trigger in a natural cycle intercourse. All these factors also contribute to that 3 year interval which you mentioned of having unexplained infertility. In all this situation, quite a lot of times what is going to happen is, patient will take treatment for 3 to 4 months, break the treatment for 3 to 4 months, again take the treatment for 3 to 4 months from some other doctor, again break the treatment because the results are not coming. This is not because all patients would have an idea of who is a good fertility specialist. They would just read some information from somewhere, and they will go to a particular place and do a particular thing, right? If you thoroughly optimize all these things, okay, then you will do a very good job as far as IUI is concerned in unexplained infertility, because a lot of patients who are having just 3 years of unexplained infertility would really want to opt in for around 3 or 4 IUI cycles before going in for IVF. Okay, if they've not done it before. See, if they've done 3 IUI cycles, then if you tell them now you do IVF, they will be happy. But these days, there are hundreds of support groups going on as far as fertility is concerned. Most of them are patient generated support groups. One patient is trying to guide the other patient absolutely incorrectly, right? So, what is the bottom line in that is, minimum 4 to 6 IUI cycles should be done. So, what is ingrained in the head of the patient is that if I have done three, I can at least do 3 more IUI cycles before I opt for IVF. Because no matter how much we try and explain, in the head of a common patient, IVF is an artificial procedure, right? They think that things are taken out from the body, things are taken out from here, there, something is made inside it. Who knows if it is my embryo or not? All these types of, ingrained disturbances are common in their head as far as IVF is concerned. I'm not saying that you don't do IVF when the patient has agreed, but I'm saying that giving IUI, and a good IUI, is a very, very good option, very viable option for these patients, provided you have investigated all these things for that particular individual. And one of the most important things is to investigate for DNA fragmentation. Yeah, I conclude.
Conclude.
Yeah,
But yeah, you didn't even counter majority of my things. I mean, you would still do ovulation induction, you would still do IUI for
yeah,
the patients who have unexplained infertility. I mean, forget DNA fragmentation. I know, I mean, that is something which is recent, but you think it is still worthwhile for generalizing the group or
yeah. At least for 3 cycles, madam. It is worthwhile.
uh, okay.
Because you mentioned that IVF will finish in 1 lakh rupees, right? It is not really true. Most of the times, IVF cycles will take 1.5 lakh rupees, madam. Even people who are doing free IVF will take 1 lakh. Okay. So that 1 lakh rupees is not a very sustainable budget for IVF. Okay. Second, you mentioned about ovulation induction with gonadotropins going to 25,000 rupees. Okay. So actually, the ovulation induction with gonadotropins, if you are doing it judiciously, will not exceed 5,000 rupees. Okay. And gonadotropins, as such, also, if you are using 1200 international units, the landing cost to the doctor is less than 4,000 rupees. Okay. So that doesn't really exceed that much amount of money. I'm not talking of the MRP based things which people do. I'm talking of cost to the doctor. Okay. So that will not exceed that much. And I think that is a much, much, much uh, better thing, because a lot more people who will drop out from your system because you mentioned IVF and would want to go to an alternative therapy will continue with you and will become pregnant. Okay. And will add to your goodwill. Because at the end of the day,
Yeah.
number of people becoming pregnant at your center matters.
So I think to conclude, one is like try out the alternative therapies if the patient is willing to do it. Second is yes, I mean 3 cycles of IUI can be offered, but I think we should have a age cutoff to this, wherein we can offer IUI 3 cycles if the patient is 35 less than 35 years and haven't tried IUIs before. Do you agree with this?
Yeah, I can hear you. I
Yeah.
can hear you.
I'm sorry. So do you agree with that point wherein we have to offer 3 cycles of IUI if the patient is less than 35 years and if they have not done IUI before?
Definitely. Definitely. In fact, even patients more than 35 will want to do IUI.
But I think we should offer them both the choices and if they choose, see, because it is patient
Offer
individual.
both.
Yeah,
Offer both and let them choose.
let them choose. Yes. And finally, coming to financials, I think anyway, as India is developing countries and we have enough and more access to IUIs than to IVF, I think IUI need to be offered on couples as the first line of treatment rather than IVF, though the nice guy or though the studies, Cochrane review, everything seems that IVF can be a better option in terms of success rate, in terms of cumulative birth rate, in terms of like time taken for pregnancy. But I think IUI is a viable option in our country, at least in patients who are less than 35 years and who have unexplained. So with this, anything else you want to ask?
See, madam, one thing which is important to understand is that till India stays below the per capita income of 6 to 8 thousand dollars. Okay, till that point in time, any review or any publication which is published by a foreign country will not hold true for majority of the Indian population, because the population which is opting for fertility is usually going to be a young population. Okay, it is going to be a population which is settling down early in their career. Okay, and money is going to be an important factor for them.
Yes,
It is not like other countries where fertility is a state sponsored scheme, right? In most of the other countries, fertility is a state sponsored thing. So they can do what they want. In India, fertility is not even covered by most of the insurances.
thank you very much for that point. I think, yeah, we are at the end of our session. So thank you very much for joining.